Good day, all. This is another short episode, continuation of the Patient Dignity series that we started yesterday. And we're going to talk about the foundation of patient dignity that everything builds upon. And really, that foundation, and it's something that affects everything that we do in the healthcare field. In a way, it should affect everything that we do in the healthcare field. But in a lot of circles, and you know some employees that completely lack this quality entirely, and that quality is empathy. I'm sure that many of you know what it means, know the general idea, but just for this purpose of this episode, I'm going to read you the exact definition of empathy so that we can kind of begin with that and start an understanding on how patient dignity comes into play with this. So, Merriam-Webster's, if I said that right, their dictionary definition of empathy is the action of understanding, being aware of, being sensitive to, and vicariously experiencing the feelings, thoughts, and experience of another, of either the past or present, without having feelings, thoughts, experience fully communicated in an objectively explicit manner. It's a lot to unpack. What that says to me is thinking about them, thinking about the other person's feelings, thinking about the other person's life experience, thinking about the other person's wants, needs, hurts, fears, all these things that make up a person. It's us thinking and considering those things is what I would definitely define as empathy. This is core to patient dignity, core to it. If you have no empathy, patient dignity won't mean jack to you. Not a single bit, because you don't care. So without empathy, we can't really go any further. But empathy is the start. It's something that we need to do every day. It's the kind of stuff that, when we infiltrate somebody on accident, because nobody's ever done that, we get them an ice pack. We apologize. We recognize that, damn, that hurts. I'm sorry, didn't mean to do that. But we feel for their pain and we react accordingly to that. As healthcare professionals, that is something that is foundational to what we do. Patients come in with high fluid. We react. We realize that you can't breathe, that you're drowning in your own body fluid. We're going to take that off of you and we're going to make you feel better. I could do 2 hours on empathy, but we're not going to. So what I would like for you to do today or tomorrow, next time you go to work, is to think about that definition. I'll read it one more time at the end of the video just to kind of get it to stick in your head. But think about the definition and what empathy really means to you and what it means to the patients. So, in closing, Merriam-Webster's empathy, the action of understanding, being aware of, being sensitive to, and vicariously experiencing the feelings, thoughts, and experience of another, of either the past or present, without fully having their take two without having with in their experience without fully communicated in an objectively explicit manner, meaning they didn't straight up tell you, I caught my ex in bed with another man and so I'm afraid of commitment, or the last 3 clinics I went to, they treated me like trash, so I'm afraid to complain because I think that if I complain, you're going to do something to my machine to make my life miserable. They're not going to say that jazz. But empathy will help us see those things and accommodate and act accordingly. You guys have a great day.